Okay, everyone. As he said, I am McKinley. I'm giving a CERT presentation for disaster medical operations. It's basically shock, triage, and stop the bleed. And after the presentation is over, anything that's open on these tables you can touch, fiddle with, and explore. If it's closed or sealed, please do not touch it because once you open those, they have to be thrown away. Okay? So, we'll jump straight into it. Okay. So, it's basically saying that you always treat the eyes first. In triage, you have I for immediate. That means they're like bleeding to death. They need CPR or that. You have D for delayed. Basically, they do have injuries, but it's not life-threatening. And then there's G for green, like they're walking wounded. Basically, they might have minor scrapes and cuts, but they're okay. They can walk away from the accident without dying. And then there's D for dead. Okay. So START, that's one of our acronyms. The ST means simple triage. You sort survivors in their categories: immediate, delayed, dead, and walking wounded. And then the ART is and rapid treatment. Basically, you treat the eyes first, because if you don't, then they're going to move into the D section. Identify killers. One of the killers are like blocking throat, arterial bleeds, and yeah, we're going to do a simulated disaster, so you'll see more. So, like I said, we're going to be looking at life-threatening conditions, how to treat them, and triage, how to give triage. So, like I said, there's airway obstruction, something's blocking the throat, bleeding death, especially arterial bleeds, those are the deadliest. And then shock, basically that's your body reacting to serious injury and it's slowly shutting down. And those three killers are the first things you really want to treat. You really want to open the airway, control the bleeding, and then treat for shock. You have to make sure, if they're conscious, then when you go to treat them, you have to identify yourself, because they might be panicking, they won't know what's going on, so you're going to have to talk to them and reassure them that they're okay. And you have to, if they're conscious, you have to ask them before they get treated. And you have to respect cultural differences. Like, certain cultures, they think that you can't eat pigs because they think that they're evil. Like, or in other cultures, you can't have cow because they think that's holy. So stuff like that. If you're like trying to give them something and they say no, that's not part of my culture or religion, you're gonna have to find another way. Unless you become unconscious, then it's all green. And then opening the airway. We don't have to get into the technical stuff, but basically, if anything is in any part of the diagram, they're gonna have trouble breathing. And when you give CPR, you're basically breathing and pumping their heart for them, which is why it's so tiring. Okay, this is really important. The reason you have to tilt the head back is because of the tongue. When someone's conscious, their tongue, the muscle, it knows to stay there. But when they're unconscious, the tongue will slide back, blocking the airway. So the first thing you have to do if they're not breathing is tilt their head back, because it might just be that the tongue's in the way. Like that. You put your head back and with 2 or 3 fingers, you lift the chin up. And if it is their tongue blocking the way, then they should start breathing immediately or start to breathe immediately after you tilt their head back. And then we have the types of bleeding. The arterial bleed, it spurts. Basically, every time when you have an arterial bleed, every time your heart pumps, it squirts. And the venous bleeding, I can never pronounce that. It's kind of like when you get a paper cut and stuff. It's not deadly. But if it's like big enough, then you still bandage it. And then a capillary bleeding. That's basically none of the veins got touched. It's just that's just like a patch of skin came off, or those rarely kill anyone. And then here are the pictures. Arterial bleeding, it squirts. You can tell there's a lot of blood. Capillary, it's just oozing. No one really dies from that. And venous, it's kind of like a paper.
For me, it doesn't bleed out that much.
And then there's 3 methods for controlling the bleeding. Direct pressure, it's best for capillary. You press it exactly on it. When you hold a paper cut to make it stop bleeding. Elevation, like shown in the picture here, you lift it up so that way it's harder for the blood to get up there to make it bleed. And pressure points, that's what the tourniquets are for. The tourniquet will hold at the pressure point, and that restricts blood flow, and restricting blood flow is better than bleeding to death. And it's showing some pressure points. Here, and here are the main pressure points. And that's usually where people are bleeding. So. And then shock. It results from ineffective circulation of blood. After you treat bleeding, usually what you have to treat next is shock. When someone goes into shock, their body starts slowly shutting down. And so and it causes the death of cells, tissues, and then organs. And sort of in that order, which is why you have to treat it fast. And then main signs of shock, they're having like shallow breathing, like you know that breathing when you panic, you get when you're panicking? Basically that, but like it's not like you can feel it, but you can still see them have it. And then capillary refill of greater than 2 seconds. Basically, they're running out of blood. Blood's not flowing as much as it should be. And then they can't follow simple commands such as squeeze my hand or say my name, stuff like that. Symptoms of shocks can be missed easily. Like rapid shallow breathing, that can just be taken for panicking. But you always really need to be watching your patients. And then when you respond to a casualty event, you have to have a plan. You have to follow the plan and document it, which is what this book is for. This book has all the documents. You need to write it down. But if you don't have a document, the next best thing to do is get like a piece of sticky note paper, write directly on the bandage, but you have to be careful with that because you might hurt them. Write what time you put it on, because that's going to be very important for the first responders. Otherwise, you have to try and guess, and if they guess wrong, then you know. Then size up. Basically, you do this the entire time. When you go into it, CERT or not, this should be going in your head the entire time. It also helps you not panic because you're planning the entire time. You have to gather the facts, basically what just happened, who's hurt, and then we go down to assess the damage. Is someone dying? Do I need to help them? Do I need to go directly and help them? Or can I help more people move them out of the way? And then consider possibilities. If I don't help them, if I help them first, what's going to happen to the other person? Assess your situation. If you're going to help, make sure the roof's not going to fall down, because if you go in and the roof falls down, you'll have 2 victims instead of 1. Then you have to establish priorities. One of the things you have to remember is to help the greatest amount of people in the shortest amount of time. Because during emergencies, there's not a lot of time. And I know it's really hard, but sometimes you do have to leave one person to help 3 other people. You have to make decisions. Am I going to go in there or not? You cannot be indecisive. If you are indecisive during an emergency, that will waste a lot of time, and it could cost people their lives. You develop a plan of action. It has to be quick. Like I said, in emergencies, seconds matter. You have to take action. Once you decide you're going to do something, you have to do it. And you evaluate the progress. Like, did I help with what I did? And then you go back to step 1. It's a continual process. It's also good because during emergencies, you may be panicking as well, but you have to take breaths and remember, especially if you're the only one there for that time, you are it. So you have to be the one to be calm. Going through this over and over again usually takes your mind off of everything, off of like panicking and stuff, because that's the only thing going through your mind, helping others. And then triage. It's the process for managing mass casualties. Like in a car crash, if there's like 3 people in the car crash, who do you go to first? You have to evaluate the survivors. Like I was saying, if there's 3 people in a car crash, 2 of them seem to be unconscious, but one of them you know for sure is alive, go to the one that's alive. Survivors are sorted by urgency of treatment. Are they dead? Are they alive? Can they walk out? Walking wounded, you can enlist for help. They may be panicked, but they can still follow simple commands like hold the bleed, keep your hand here so that way this person doesn't bleed to death. Stuff like that. And then survivors are set for immediate treatment or delayed treatment. Those are the ones that need to be treated fast. And then here we go. Immediate. Survivor has a life-threatening injuries. One of the 3 colors: airway, bleeding, or shock. Then delayed. It does not jeopardize their lives. It's just they still need to be treated though. And then walking wounded. Basically, if they needed to, they could walk to a building and call for help, which is actually a really good idea. If you have a walking wounded, have them call for help. And then dead. After no respiration, like you can't treat these after 2 attempts. The thing is, because we're trying to help as many people as we can in the little time you have, sometimes after 2 or 3 tries of trying to open the airway, stop the bleeding, or treat them for shock, you may have to leave them. And unfortunately, in an emergency, you may have to leave 1 person to save 3. Cut off? Okay. Well, I guess that'll be it.
Kind of have Natalie come up here.
Oh.
Yeah, we gotta stay, we're already past off schedule, but we gotta stay close to it. Come here.
Okay.
And what she talked about here in a little bit, we're gonna be integrating the drones and this training together.